Like and subscribe for daily OT brain boosters. An occupational therapist evaluates a client in a work conditioning program. The therapist suspects the client may be exaggerating functional limitations during testing. Which assessment is likely to provide the most objective and valid information? C. Volumetric measurement of hand edema. Client who recently experienced a right CVA has mild oral motor weakness and delayed swallow initiation during meals. Occupational therapist wants to use a direct intervention approach to improve safe swallowing of food during feeding. Which intervention is the best choice? B. Offer small, cold boluses during feeding. Context: small boluses are easier to control in the mouth and reduce aspiration risk, and cold temperature increases sensory input, which can help trigger the swallow reflex more effectively. Client with obesity begins a walking program as part of an OT wellness intervention. Which condition should the therapist consider a greater risk during exercise in a warm environment? B. Hypothermia. An individual with facial nerve weakness after illness reports difficulty keeping food in the mouth while chewing. The occupational therapist wants to improve mealtime performance during the first treatment session. Which action is best? A. Instruct a client in compensatory lip support during eating. An 8-year-old child with spina bifida at the C6 to C7 level is receiving school-based occupational therapy services. Which intervention goal is most appropriate for the occupational therapist to prioritize? C. Fastening pants and shoes. Context: a child with C6 to C7 level involvement usually has relatively good upper extremity function, so tasks like tabletop play and upper body dressing are generally less impaired. Lower body dressing is often more challenging because it requires more trunk control, balance, and access to the lower body. Adult with a mild intellectual disability recently started attending a community day program. The treatment goal is to improve appropriate social behaviors during group art activities, such as waiting for a turn, using polite language, and respecting others' personal space, using a behavior modification approach. Which intervention is most appropriate? D. Provide rewards. When the individual demonstrates appropriate social behaviors during the activity, like comment and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.